Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Nita Valens, are you living it up?
I am. Are you as well?
Oh my God, it's a great day, isn't it?
It is.
So Nita, what happened to you when you went to Macy's to buy sneakers, but you came home with no shoes?
Well, what happened was That's
so funny. You know why? Because you sent me the joke and you don't remember what it is.
Well, I don't, and I just got, I don't know.
She got cold feet. There you go. I'm going to give you another chance.
That's a true story, by the way.
I'm going to give you another chance, Nita.
Okay.
What do you call two banana peels on the floor?
Children's bedroom slippers.
Good. A pair of slippers. I'm going to give you, I'm going to give that one to you. Okay? One last one.
Okay.
What did the fish say when he swam into the wall?
He swam into the wall? Is that what you said?
Yeah. Damn. Anyway, we're going to talk about pain today. Musculoskeletal pain, orthopedic pain, the things that people normally get surgery for that we are able to avoid surgery. And it's called regenerative medicine. And it's a technique that I've been doing for over 25 years since my residency at UCLA in physical medicine rehabilitation. And as my listeners and my patients know, I was on track to be an orthopedic surgeon. I had a surgery on my right shoulder and from weightlifting injury, and my boss did it for me. I was very excited until I woke up.
Oops.
Oops. And my arm was totally full of fluid, and I had a fever and miserable. And the shoulder was actually worse. My arm had problems moving, and I still am a very avid athlete, and many of my sports activities were curtailed for quite some time. And it never really healed. I mean, it took 4 years. And then I learned about regenerative medicine when I was at UCLA. There was a lecture on it there. And it was pretty amazing. The doctor took me to a national seminar on regenerative medicine. And while I was there, I also had a wrist injury from hitting a golf ball. Actually, I didn't hit the ball, I hit the ground. And they asked if anyone had wrist pain, and I reluctantly raised my hand because I didn't want to get a shot in my wrist with a proliferative, meaning something that stimulates new tissue to grow. But I did because I was so miserable. And it healed about 50% overnight. And then I injected my own wrist after that a few times and completely healed my wrist. I'm going to be playing golf later today, so you know my wrist is important in that. And after the wrist, I came home with a syringe and some proliferative solution. And my wife was watching TV. I hopped into bed, and I pulled out my syringe, and she started yelling at me, "What do you think you're doing?" with some other kinds of words I won't mention. And I injected my shoulder at that point, and I woke up the next morning 100% completely healed with
Amazing.
Full range of motion and no pain. And at that point, I stopped doing steroid injections. I stopped doing hyaluronic acid, the gel shot injections. And it completely changed the life of my patients also, because at that point I started begging everybody to let me try this on them. Back then it was thought of as a new technique. It actually has been around since the beginning of the 1900s, although it's actually been around forever in different forms. But in the injection form, it's been around since about 1900. And there were a couple of doctors in Chicago, Dr. Hemwall and Dr. Hackett, that did thousands of patients, whiplashes and all kinds of things all over the body, with great healing. And as they got older, it kind of fell apart. And they didn't have many disciples. So I kind of became a disciple. And I finished my residency, when was that? My gosh, 1998. And I've been told I do the most of this anywhere in the country, in the world, actually. And we now have Dr. Thomas Grove, who's doing my injections for me. I'm still at the office most of the time. My fingers have kind of worn out from injecting all day, every day for over 25 years.
I bet.
People say, well, why don't you do this on your fingers? I have done it on my fingers, but it's I'm still an athlete and I still beat up my fingers. And it's just a lot better for me to have Dr. Grove do the injections. He's been very highly trained. He's been around the field of regenerative medicine for over 10 years. And if you go to the website, which is www.jointrehab.com, on the first page, you'll see a video of Dr. Grove and I. There's some questions that I'm asking of him. And this guy is a prince. He's an amazing person. His skills are the best I've ever seen. He uses an ultrasound to inject, and that means needle guidance. You can watch the needle go into the body to get to the exact place that it needs to go to. If you're getting injected by a doctor without an ultrasound, you got problems, because the studies show that at least a third of the time the needle is not even going to the right spot. So that's not something I'd want to do. I wouldn't want to have someone injecting me who doesn't use an ultrasound. What else here? Let me see. I want to get some phone calls so it makes the show interesting. I don't want to just keep blabbing or making Nita answer silly jokes, but I can do it if you want me to. But if you want to save Nita, give us a call right now at 866-870-5752. That's 866-870-5752. That's live at the studio. I'm here. You can ask me all kinds of questions about musculoskeletal pain, orthopedics, arthritis, neck pain, back pain, shoulder pain, elbow pain, wrist pain, finger pain, arthritis in the fingers. We get lots of that. A lot of toe arthritis, ankle pain, knee arthritis, meniscal tears. Shoulders often have labral tears. That's a lip around the shoulder that holds the humerus bone in. And for those of you that don't know these terms, just Google them. You can Google them while you're listening. And at the upper left-hand corner, as an example, if you're on your computer now, you can look up the word labrum, L-A-B-R-U-M, and then in the upper left-hand corner, there is a menu button that says images. Just click on that, and it'll show you tons and tons of photographs and drawings of what these anatomical things actually look like. So if you've been told that you have a herniated disc in the back or neck, look it up. You know, people are becoming very educated because of the internet. Google's a great search engine, and it's very easy for you to actually look at what these things are rather than just hearing your doctor talk about them. This is a new age of medicine, and the new age has to do with regenerating the body instead of cutting tissue out. Cutting tissue out failed me personally, and regenerating the tissue helped me. I have self-injected both of my knees with stem cells and platelets. Both of my shoulders I've done my elbows, my right wrist. What else? I've had other people inject my neck and my back. I was at a world conference on regenerative medicine years ago, and when they said, who's got pain, I raised my hand because I'm always injuring myself in sports. And I had pain all over the place. My entire back, from my neck all the way down, was stiff and sore. And so they had me lay down on a table. I was the living example of pain. And they had all the doctors go around the table, stand there watching. And the leader of the seminar injected my entire back with, I'm going to say, probably hundreds of injections. And the picture they took was very funny because I was laying there being injected for about an hour. These procedures don't take that long, by the way. It usually takes me about 10 seconds or a little bit more to inject. But this was a very comprehensive set of injections, just me being the guinea pig. And the pictures that they took of my face were very funny. I mean, they took a picture of my whole body, but my face was purple. I was all lit up because, to be honest, I didn't like laying there for an hour being injected. And thank goodness the body parts that we can do very quickly now. And we use basically platelets from your blood, which is called PRP, platelet-rich plasma, and we can mix it with your own stem cells from your body also. And that's a very simple procedure also. We do it all day long, every day of the week, and we'd love to hear from you. You can call the office directly if you want to get a free consult from my staff on the phone. And the phone number to my office is 800-300-9300. That's 800-300-9300. The website has tons of videos of me and Dr. Grove injecting, and that's www.jointrehab.com. That website will teach you more about regenerative medicine, stem cells, and platelets than you'll find anywhere else in the world. And what we write down and what we show is real. It's not a lot of nonsense that I read about on the internet from people that don't do very much of this. We read about these guys who do, they call it miracle treatments. And this is not a miracle. I'm just being honest with you. It just makes sense when you stimulate the body to produce collagen, which is a major constituent also of cartilage. We're stimulating tissue to grow. Is it a magical event? No. Is it take one treatment, like a lot of these guys say? Sometimes, but usually not. It can take more than one treatment. What are the biggest failures in regenerative medicine? Too much activity afterwards. Let the body part, please, let it heal. I get people who come in, they get one injection somewhere. They come back 2 weeks later. We have everyone come back in a couple weeks, if they can. And they say it didn't work. And I say, did you do activities that were bothering it? And sheepishly, the honest people will say yes. The dishonest people will say no. And then their spouse sitting there will roll their eyes and go, come on, honey. You went out and played golf 3 times. So overactivity is not a good thing for healing. You got to let the tissue grow back in. Some people sneak NSAIDs, that's anti-inflammatory medications. We need the inflammation to heal. It sequesters fibroblasts, which are cells that actually grow the collagen, which is a constituent of cartilage. So all of these body parts that we work on healing, the tendons, the ligaments, the joints, the cartilage, we need a little bit of inflammation. Ibuprofen is the biggest culprit, but there's hundreds of different anti-inflammatories that people take. And another fault of this is patients don't get enough treatment. They go, I did it once, it didn't work. And I've been lucky. Typically in my body, I inject it one time and I heal. I guess I must be a pretty healthy guy. But a lot of people take a few treatments. So another reason for failure is a doctor not using an ultrasound. We need to see where that needle is going inside the body. And then I'm going to say something that I don't know how the right term, a bad doc. A lot of times there are nurses doing these injections. There are clinics outside of the country that people go to. They'll spend $30,000, which is absolutely insane. This is not that much of an expensive procedure to do it. It's quick. And they'll get IV stem cells, which basically do nothing. It can make you feel good for about a week, and then you go back to your same situation as before. It's a good anti-inflammatory. It's good for rheumatology if you're having let's say a rheumatoid arthritis flare where your joints are red hot, then go out of the country and get stem cells somewhere. But it's not going to fix it. You've got to go directly to the area. And I know you're going to read books about this. You're going to read the internet about this, all these miracle cures. I've never seen miracles like that. I think there are miracles, but it's not really miracles. It's just people can get better if these techniques are done properly. I'm going to give out the phone number so Anita doesn't get mad at me. And you can call us right now, live. And as Dr. Gene used to say when he was my host, live and local. And the phone number here right now is 866-870-5752. I'm going to repeat it. If you're driving, you can pull over to the side of the road to be safe. Pull off your Bluetooth so we can hear you very well. And the phone number again is 866-870-5752. Anybody who calls in will get a free copy of my book. It's a couple hundred pages with about 250 scientific studies on how regenerative medicine of platelets and stem cells actually work. These are actual scientific studies, peer-reviewed by other doctors, and it shows why surgery is no longer the answer for these type of injuries. I'm not putting surgeons down. They do the hardest work in medicine. I love surgeons. I'm glad they're so energetic about doing surgeries. But please, guys, stop doing the meniscal tears, the labral tears, all of these things that don't need to be done. We can heal this stuff with simple injections. Patients walk in the office, get their injections, and walk out. You do not need anyone to drive you home or drive you there unless you want a sedative. It's very rare people want a sedative, but once in a while we get someone who goes, I'm really needle phobic, I'm afraid of shots. We'll give them some Xanax, which makes them a little bit relaxed. But then they have to have somebody drive them home and put them in bed because they're going to probably fall asleep later. So yeah, simple procedures. For the PRP, we just draw the blood, from your arm. We spin it, and then we pull out the platelets from the plasma and throw away the red cells because they irritate the tissue. And then we inject the platelets, and we can do a similar thing with your bone marrow. Very simple procedure. It's very much like doing PRP, but we take the bone marrow from the back of the pelvis. And there are videos of me doing both procedures on my website, www.jointrehab.com. For a free phone consult with my staff, call my office, 800-300-9300. So, Anita, I think it's time for some questions. What do you say?
Yes, I think so. And also we can remind people that when they call the program today, they get a completely free book, your latest, called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies.
And I will pay the postage.
That's
right. It actually cost about $8 to send those books out. And it's a $25 book, so it's a good value.
Yeah, it's a great opportunity.
All right, so you'll let me know if we get some callers. I'm going to find some questions.
Actually, I think one is coming in right now. Do you have a quick question you want to answer?
Well, actually, no. I want to mention we also do these procedures on the face. It's called the vampire facelift. Makes you look good. It regrows the collagen in the face. As we age, the collagen all over our body, not just the musculoskeletal system, but the face dries out. In the musculoskeletal system, we find things like the cartilage wearing down, the discs in the back become degenerative, and these procedures can help all of that grow back. The other thing we can do with these cells, platelets or stem cells, is we can put them on the top of your head if your hair is starting to thin, and regenerate the follicles and fortify them to start growing the hair back. If you are a billiard ball head, it's not going to probably give you enough hair. It'll give you some hair, but probably not enough to make you real happy. So we use it on three things. One is the musculoskeletal system, joints, ligaments, and tendons, and then the face for the vampire facelift. You'll never forget that term, will you? And then also for hair regeneration on the top of the head. So this is amazing. Here we go. What is this person's name? Put that name up there so I can talk to them. Almost. Well, maybe I should go to a question instead, and then you can let me know when the person is ready to speak. How's that, Nita?
I think that Steve is typing it right now.
Ah, there we go. Betty. Betty. How are you? It's Dr. Marc Darrow.
Good morning. Good morning.
How are you?
I'm planning to make an appointment to come see you, but I need to find out how long should I be off my blood thinner when you get ready to do whatever treatment.
Do you know the name of your blood thinner?
Pradaxa,
Okay.
110 milligrams,
Okay.
BID, and it's 12 hours apart.
I gotcha. By the way, I'm taking one myself right now called Eliquis.
Yes.
Kind of similar.
Okay.
I love talking about this because I had a cardiac ablation on October 18th and got rid of atrial fibrillation. And so far, I'm out of the hot water. I don't have the arrhythmia anymore. But
That's great.
my doctor, Eric Bush, Buch at UCLA, who I adore, did the procedure. I woke up without atrial fibrillation. I've been good ever since. And
That's wonderful. But
he wants me to stay on the blood
HMO,
thinner. He wants me to
they
stay on. He wants me to stay on the blood thinner a little bit longer. I haven't had any AFib since then. And if anybody wants to talk to me about AFib or a cardiac ablation, please go to the website and just email me at www.jointrehab.com. It's something that's very easy to do, and it's not safe to have atrial fibrillation. You can have a stroke. And if you don't take care of it, even if you're on a blood thinner, it can actually deteriorate the status of the heart. I have an old friend who refused to get the procedure. She went in to get it, and on the table, she freaked out, didn't do it because she was afraid. And now she has a terrible heart condition because of it. So I recommend people to do it, and anybody who wants to talk to me about it, it's not my line of work because I just do orthopedics, but I'm glad to help people understand atrial fibrillation and what a cardiac ablation is all about. Anyway, I never take anybody off a blood thinner because that's up to your doctor to do it, Betty. If they want to or don't want to, that's up to them. So the reason for that is I don't want you to have a stroke, and I don't know what your underlying condition is. But typically, if we do a knee or a neck, I'm going to want people off a blood thinner. You have to ask your doctor to take you off. Usually it's about a day or two, and most doctors allow it. Once in a while they don't, but so far I think everybody who's come in for a knee or a neck. And the reason for the knee and the neck is in the knee, if the needle hits a tiny little blood vessel, there's no big blood vessels inside, but if you hit a little tiny one, the blood can leak into the knee and cause a lot of pain. So I don't like that, and the patient doesn't like that. So we get them off the blood thinner. In the neck, there is a vertebral artery, and we don't want to tweak that and have a lot of bleeding. So you'll have to ask your doctor about that, Betty. What body part are you coming in to have injected?
my knee.
Okay. Yeah, then you'll have to talk to your doctor first.
I did talk to him.
And what did he tell
That's
you?
why I was asking you.
Well, don't ask me. Ask him. What did he tell you?
Off of it. He told me I could be off of it like 3 days and then go back on it.
There you go. So that's your answer. That's what I would follow.
Oh, okay. Well, thank you. I'd like to get your book.
Yeah, we're going to mail it out to you. And we already have your phone number, so we're going to call you right after the show. And we'll get your address and send you out a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, 200 pages of studies and orthopedics information and how to save yourself from a surgery you're not going to want. And I say it like that because I had a shoulder surgery that failed me and gave me years of misery until I learned about injecting my own shoulder with regenerative medicine. And I healed overnight. It doesn't always happen like that, believe me. It often takes a few shots, a few treatments to get this going. And in this book, there are 250 studies about regenerative medicine and how it stimulates tissue to grow and how to heal without surgery and how surgery is not very good for people. All right, you can hang with us if you want. Betty, we're going to the break. And thank you, everybody, for listening. God bless you all. And if you want to call the studio right now and talk to me, the phone number is 866-870-5752.
And we'll be right back after this.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned. You're listening to Living Pain-Free with Dr. Marc Darrow.